from the perspective of teenagers or probably anybody, there's, a less perception of being judged when you're communicating with technology that's not a human.
I'm Dr Louise Messara. Welcome to Season 4 of the Future Health podcast, Future Proof, a podcast about the future ways we will work, the work we will do, and the impact of technology and scientific innovation on the future of the healthcare industry. We have a fantastic lineup of guests this season as we cover topics ranging from life-saving cars to robot lawyers and even diagnostic t-shirts. So go ahead and like, share, or subscribe now so you don't miss a thing. Most of us are pretty comfortable discussing our new comprehensive car insurance quote with a chatbot, or even asking a chatbot for help when we're struggling to log into our online banking account or forgot a password at work. But how would you feel talking to a chatbot about the challenges you're having with a new coworker, or your fears about a partner's increased phone activity late at night? Would you share your feelings of anxiety with a clever piece of software? And even if you would you take advice from an AI psychologist? Some people are, and it's a trend that's on the rise. I'm Dr Louise Messara, and this is Future Proof. So today we're speaking to Dr Charlotte Keating about the evolving role of chatbots in the mental health care space. Charlotte has a PhD in neuroscience and is a clinical psychologist predominantly working with teenagers and young adults. Dr Keating, welcome to Future Proof. Look, you can't open an Instagram feed or a newspaper without hearing about ChatGPT passing exams and doing all sorts of things. There's just an explosion at the moment in the public's interest in sort of technology. Why do you think there's been such an explosion in mental health chatbots, for example?
Well, I think essentially the rise of chatbots in psychology contexts, it really comes from a broader kind of context of online programs and online service delivery that is probably happening in response to a really increasing demand and need for psychologists. Certainly in Australia, but other countries, developing and, developed countries, there's a real lack of face-to-face psychologists available for people. I read the other day that in India, for example, there's around 10,000 psychologists for a population of 1.3 billion people. So I think that there is just a huge unmet need, and that creates the opportunity, for this type of technology.
I mean, some might think that, a chatbot is a pretty impersonal approach to talking about some pretty deeply personal issues. But it seems that particularly the teenagers and maybe the young adults too are preferring to speak to their devices rather than a human. Does that make sense to you?
I think on a level it does. Teenagers these days, they're digital natives. They've grown up with technology and they've sort of never known a world without technology. I think for them, communication, via their devices is just such a normal thing to do. The idea that as well you could be on an online platform, seeking help, it's not new. It has existed for quite a little while in terms of online modules that people can work through. There's been counsellors online or that can text you. So I think this way of communicating via technology is certainly something they're comfortable with and isn't new. From the perspective of teenagers or probably anybody, there's, a less perception of being judged when you're communicating with technology that's not a human, even though psychologists, allied health professionals, they're not trying to judge us, of course. But where teenagers are concerned as well, I think if we put ourselves in the shoes of a teenager, if they want to talk to a psychologist, they first have to ask their parents and disclose what might be happening for them. They then have to ask to go to the GP to then get a referral for a psychologist. And each step of the way that potentially involves a cost as well.
And a disclosure, I suppose.
Cost and a disclosure.
Yeah, okay.
And we know that teenagers, don't necessarily feel comfortable, even in the context of trusted adults necessarily, talking about their struggles. So it is a different option available to them that doesn't involve those factors.
Are you worried about the loss of that face-to-face relationship? I mean, we talk a lot about in healthcare about the value of the patient-doctor relationship, in your case, the client and patient relationship. And I suppose, it's interesting now post-COVID. Did COVID change things from that perspective?
Interesting question. I think for certain modalities or certain treatment approaches, probably the face-to-face work is difficult to, transfer online. But I think for many people, certainly because of COVID, needing to access services online, they have. And I think what we can see after the pandemic is that people are still opting to have their sessions online. It's probably helped by the government, having enabled Medicare to be used for telehealth and online sorts of services without there being the sort of geographic necessity for that. So I think people are certainly more comfortable with it. When you consider it too, online modes of therapeutic delivery tend to be as efficacious, according to a lot of the research, as in person as well. So I think there's certain situations where, in-person is important and preference and otherwise can dictate it for other people.
So I was trying to think about some of the other elements that a sort of a chatbot wouldn't be able to bring to the party. And I was thinking about what can be gained from sitting across from somebody, watching their reaction to a question, reading someone's body language, both from the therapist's point of view or the counsellor's point of view, but also from the patient's point of view. I mean, it's not something the chatbots can do yet. Do you think it's an important part of your process, being able to read those cues and adjust your approach or therapy appropriately?
Mm-hmm, definitely. I think, as humans, we tend to communicate verbally, but also non-verbally. Body language, facial expressions, even, eye contact. When you're trying to develop a connection with somebody, being able to perceive, their experience in the room and then being able to experience, your body language as well is part of that opportunity for connection to develop, for understanding and hopefully trust. And I think that can, certainly be something important in the therapeutic process. But equally, I'd be, interested in understanding research in time to understand whether people who are using chatbots or other online modalities require, that aspect in order to form trust, as it were.
I mean, we're not talking about one day in the future technologies here. It's not Meet the Jetsons flying car. There are actually chatbots on the market today. I mean, in preparation for today, I downloaded one or two and had a go. I mean, they're there to support and provide advice and offer coping strategies. Maybe as a professional in the space, could you tell us a bit more about what's out there today?
Yeah, sure. So there's a number of different, chatbot services available, and I think that they tend to differ whether they're free to the people trying to download them or whether there's an element to, full access that involves a subscription. The majority that I've looked at tend to involve sort of principles of cognitive behavioural therapeutic approaches, perhaps positive psychology and some other elements to them. My use of them so far, in checking them out, it tends to be perhaps for the management of depression and anxiety, and perhaps less sort of severe symptoms, maybe just relationship sort of difficulties and those sorts of things. It can give you some tools and some strategies to use. They're quite conversational in nature, which I think might be part of how they're perhaps more engaging in some ways for some people than using perhaps online modules that you tend
more
to
academic
work through.
And
yeah,
the modules,
a bit more academic with the modules and a little bit less sort of to and fro with that interaction that can be a little bit more motivating perhaps or interesting.
Do you think the chatbots are trying to create an environment where we're forgetting we're talking to a computer?
That's an interesting question. I'm not sure. I think there may be that aspect to it. I think there's a lot going on in that it's new and quite exciting. But I think in the most part their intention is to educate people about, their emotions, their self-awareness and strategies that they can use to sort of improve their day-to-day.
So the research at the moment seems to still sort of suggest that the chatbots, it's early days and the research is they're still experimental in nature. You mentioned that most of them are sort of deploying a CBT approach. So in terms of their functioning, are they created by psychologists, mental health professionals? Are these just people trying to capture a piece of the market? What have we got going on?
Look, I think they operate, essentially based on natural language processing and looking for sentiments in conversations, and then they have extraordinary, data processing capacities that are sort of behind them. But from a development perspective, I think a lot of, and I would encourage people to look into this, but I think a lot of the apps are working in conjunction with scientists, psychologists, people who are, really able to bring rigour to the development of these and the approach. So I think they're grounded in some evidence. Certainly there's no, significantly scaled randomised controlled trials that are, say, comparing the efficacy of these to in-person therapy or other approach, but there are some small scaled studies that are demonstrating, some efficacy of using, say, a chatbot for managing certain symptoms compared to, say, information that you might read, and showing some demonstrable impact, after a few weeks of having access to them. So we're in our early stages of demonstrating their reliability and capacities, but there is some evidence out there.
I signed up to Wobot, which was one of the free bots, and I believe came out of Stanford University. I found the way of interacting with the bot was a bit limited, but I'm interested in what you feel the sorts of issues are that the chatbots are sort of best equipped to deal with at the moment. I mean, we all see maybe the potential of where this could go, but today, for people that are looking for support, what are the sorts of issues that they would go to chatbots with?
Good question. I think, if you're asking yourself questions like, I'm feeling anxious, or I would like to know how to manage my mental health, or I have a friendship difficulty or a relationship sort of struggle. These are the sorts of questions, I guess, that perhaps the mild to moderate sorts of challenges that you could approach one of these apps with. They are quite clear when you engage with them that they're not, for crisis support. But I think, it reminds me sort of the mindfulness and meditation-based apps that are already out there. There's many of those that sort of have a different user experience, and I think, it's for people to try a couple of different ones to see which one might resonate most or be most comfortable for them. But those are the sorts of questions that I think, could be quite useful to ask and receive responses to.
So when we think about disruptors, that there has to be sort of an issue really for a disruptor to find its way in to a sector or an area. And there are certainly commonly listed barriers that the community would list in relation to accessing mental health care support, and there are issues of stigmatisation and limitations of time and location. Certainly cost for a lot of people is an issue. I'm interested in if we accept that these are the early days of this initiative, but that there's scope. Can you sort of see where chatbots can in the future play a significant role in maybe an adjunct way to the mental health care professionals we have at the moment?
Yeah, I think so. I think, in some ways they're quite useful for people who maybe haven't yet had any contact with mental health services, a way of sort of being able to socialise to what mental health is about, how to understand ourselves, have more self-awareness, basic level techniques that can be useful for helping us feel better, perhaps check in on the way that we think. I think they can be really useful, in that capacity. I think in other ways, it can be valuable if there's wait times for a psychologist as a sort of interim or a way to deliver some of the psychoeducation that might otherwise be delivered in the early stages of therapy. And that can, of course, free up clinicians to perhaps help other people who don't, prefer that, way of taking on some of the aspects. I think it could also be useful in terms of, triaging, being able to sort of have some role in the intake and onboarding process and screening questions that might need to be asked, or other administrative sorts of tasks. I also think there's, a role for them, and, in fact, pre-existing monitoring tools really for that, between session session time where people are wanting to implement what they're learning in session, and these sorts of chatbots can be a way to reinforce that learning or perhaps extend it even. So yeah, I agree with you, Louise. I think currently they are not a substitute, perhaps for therapy, but they are certainly, capable of being very helpful and an add-on at this stage, at least.
I mean, you've listed a whole lot of tasks that I imagine are sort of pieces of the job that a lot of psychologists would be happy to divest themselves from in order to be able to have more time available for very intensive interventions or time with their clients. It is funny that, we've been talking to lots of different professionals in this podcast series, that a lot of the first reaction of professionals is, but what about my job? What's going to happen to my job? It sounds like maybe the discussion amongst your cohort, I don't know, are you hearing that? Do you think there are lots of people that are very concerned about a takeover by the chatbots, or do you feel like there's a genuine understanding that there's maybe some pressure that can be taken off some very overworked mental health professionals?
Yeah, look, I think it's probably fair to say that it's fairly early in its development. There are certainly opportunities there, and it will be for people to realise how it can, really be a facilitating component to their practice. I can certainly imagine for organisations at scale where they're, spending a lot of time on these sorts of tasks and processes, that it could really relieve the burden for them, but also the burden of having to wait in order to be helped. I was also reading the other day that people were suggesting that perhaps the chatbots could be a little bit like a real-time supervisor for people giving therapy to patients, to sort of let them know what they might have forgotten or could otherwise offer by way of therapy.
I'm sure that'll be really appealing to a lot as well. Yeah,
it's interesting, and I mean, of course, that then brings into consideration some of the issues around it listening and data privacy and those sorts of things. But like any technology, I think it's worth understanding what can it potentially do and offer, and there'll be people for whom it really is helpful to and a preference for, and others not so much. But what might it be able to do?
I feel like we've taken a very positive approach so far, and I think we've looked at the ways this could really be a successful adjunct to a professional group. But there must be some concerning features of chatbots as well. Could you take us through some of the downsides potentially of turning to a chatbot rather than seeking a human to deal with a mental health problem?
Yeah, look, I think in some instances, one of the obvious ones that comes to mind is that somebody might not go on to seek the healthcare that they do need if they engage with a chatbot thinking that, the issue is resolved or managed for them. So it may be a little bit of a barrier to going on to care. I think there's also important sort of ethical and legal and social implications to consider. For one, data privacy is important, and although at the moment these chatbots tend to be quite limited in the conversations that they do have with people, and the sort of data they can collect is therefore quite limited, the more they simulate the human conversational experience, the more data they're capable of being able to collect, and how will they manage potentially huge amounts of conversational nuanced data that happens between the bot and the person. I'm interested in the business model side of things, and I think about social media, it's all about capturing our attention and retaining our attention. With respect to these, I think it's really important to remember that, we want people to be able to be helped, but we also want to help them to connect with people and socially, enjoy their friendships in real life, because that's healthy. So what's the sort of commercial potential benefit there? And, there's other sorts of questions around the regulation and storage of information that I would want to know about. So, yeah, there's questions about consent. There's questions about, the long-term storage of data. If somebody wants to delete their data, how do they go about that? How transparent is the plain language statement, of these different bots, and how encouraged people who want to use these services to go and look at that, those plain language statements as well, because quite often if you might need help, you're in a rush to just get to that help and skip past perhaps some of the well-intended, terms and conditions that get presented. In the context of using, one of the apps the other day, I was thinking to myself, well, if it asked me about, what I wanted to talk about, and perhaps I wanted to talk about a difficulty in a relationship or a friendship, and I happened to use, the person's name in an identifying way, it was interesting how there was no suggestion not to use people's full names or otherwise. And then the mind sort of, wonders about the storage of that information and how's the data treated and those sorts of questions. So I think the same sorts of concerns that we have for pre-existing platforms and, the way technology works with privacy is probably applicable.
I think one of the points that you raise around sort of the importance of maybe even a therapeutic window. So you go in to receive help and you may need lifelong help, but, one would hope that you can go through a package of therapy and come out with some tools and techniques that allow you to get back and interact in as productive a way as possible. I mean, given young people's love of device as it is, you can see how they're a very rich target for perhaps, the potential for misapplication of this sort of technology. Have you read anything or seen anything that sort of looks at how we're going to protect young people from yet another sort of device? I don't want to sound negative about them, a device sucking thing. Like it's, sucking their attention away from the world that we're actually living in. Given their interest in using the device, they seem already at a higher risk. What do you think about that?
Well, I mean, of course, I would like to think positively about, the wellness space and, people's intentions behind developing these apps. But of course, there's the potential opportunity for anybody to get involved and to develop something. And, your ability to know what it's about, what its intentions are. It's sort of reminding me of how we explain to, patients at the beginning of, their journey, the sorts of expectations they can have and what it might be like. And that, doesn't necessarily happen with a chatbot per se. But I think, it's probably another area for, parents of young people to understand, for GPs who are potentially referring clients to psychologists where there might be an interim period to understand, and for psychologists, obviously themselves, as part of the work that they're doing to know what's out there. But there are certain ones that can get caught in the net of what looks like, potential well-being, and it is a little bit less targeted for well-being. I had a look at one the other day that was more an avatar-based approach, and I was putting in a statement of, I'm feeling a little bit low. And the response that I got from the avatar was really surprising. It was, can I send you a selfie? And would you, there's a range of different selfies it could send me. And I just thought...
Selfie of the avatar.
And then, other of these also ask you, whether you would like to take a picture of whatever setting that you're in the context of how you're acknowledging your feeling. And so there's the potential for a lot of information also to be shared that perhaps a young person or even, not a young person mightn't entirely be considerate of and just surprised by.
And I think that really probably takes us into the question of governance in this space. How are these chats being monitored? What are the referral pathways in and out? Are the chatbots set up such that if I'm using are there triggers from my language that are going to direct me to a human intervention? Are the mechanisms robust enough to catch people who need an urgent intervention, or are we still in the sort of grey zone?
Look, I think, of the ones that I've had a look at, they're certainly, quite upfront. They acknowledge that they're not a crisis service and that they, are not sort of intended for that purpose, and they'll explain, the limits of their capacities in those sorts of ways. But I think what you highlight is a really important and sensitive area of governance and how to manage the, interaction between using one of these in clinical, practice as an add-on to what you might do, or or even as a separate entity if somebody's engaging it and, it's clear that they are struggling and there's something that the chatbot perhaps missed or didn't otherwise raise a red flag for. So I think that there is, there's also the issue of different jurisdictions and what's required in terms of, the interaction between somebody's health and duty of care. So I think it's a really important area that is still, effectively under construction, perhaps, in some ways.
So as a treating psychologist, what are you going to be watching for in the chatbot evolution before you expect this technology to be sort of really useful to you and the community you serve?
Well, as far as sort of my experience to date and my reading to date as well, is I think that people probably really enjoy, I can't speak for everybody, but I think people would feel quite held by a conversation with a person where there is empathy, there is understanding, there is the timing and nuance of how questions are asked, when perhaps sensitive but intentional challenges are made during conversations, that that to and fro that really comes from a very deep understanding and connection. When you go on these apps, there's certainly value to them, many of them, in terms of the CBT principles that are offered, but sometimes they don't understand what language is coming their way. They might respond in a clunky way to a question, or they may sort of miss the point or have a misattuned response. And I think that that's probably those capacities to be empathic, to be able to be timely, to just get a little bit more clever as they learn to develop with people using them, that those aspects will be important to their ongoing utility.
So we need the chatbots to be a bit more human. That's the answer.
That's what it sounds like it, doesn't it? I think the focus is quite squarely on, AI and really how it's going to potentially be supportive from an administrative and an adjunct sort of capacity, and then this, sort of burgeoning opportunity, I guess, for really learning how to be quite sophisticated in the way it converses and can meet the needs of many people for whom, access to, in-person sessions and care might be out of, unfortunately out of their reach. So I'm watching it closely and, look forward to seeing what happens.
Dr. Charlotte Keating, thanks for your time today. We'll be watching with you.
Thank you.
Go ahead and like, share, or subscribe now so you don't miss a thing.